Meet Lynn. Lynn works for a health plan that's responsible for managing applied behavior analysis, or ABA services, for children and adolescents on the autistic spectrum. Lynn knows that ABA therapy can significantly improve treatment outcomes for children on the spectrum, and that these services can be a lifeline for their families. She understands that oversight of this service is extremely important. However, it is unlike any behavioral health service that the plan has managed before, and Lynn and her team don't quite know where to start. That's where Alliant ASO can help. Lynn and her team met with Alliant ASO to discuss the health plan's goals of confirming that quality ABA services were being provided and that their members were making progress. Alliant explained that effective ABA services are data-driven, and that in order to demonstrate progress and support decision-making, providers must utilize a robust process for both data collection and analysis. In addition, the role of parent training was discussed as essential to treatment, with positive, timely outcomes for the child directly correlated to active parent involvement. With these priorities in mind, and a comprehensive review of the health plan's policies and documentation requirements, Alliant collaborated with the health plan and created a customized audit tool with a goal to provide comprehensive, meaningful feedback on the quality of care being provided to members. The first audit of a large community ABA provider established some opportunities for improvement. Some of the assessments did not contain sufficient family dynamics or history, potentially missing relevant information that could influence treatment. A more concerning finding was that none of the treatment plans utilized baseline measurements for targeted skills, hindering the ability to assess progress. In addition, there was no evidence of parent-guardian participation in the treatment planning process, and parent goals were often unmeasurable or missing entirely. These audit findings showed clear evidence that the health plan's commitment to ensure quality care for ABA recipients was a good idea. With Alliant support, the health plan prepared to engage with the provider to discuss the findings, including the provider's operational processes for data collection, progress monitoring, and parent training. The meeting between the provider and the health plan was successful, and together they were able to identify processes and documentation needing improvement and training needs for their analysts and technicians. Lynn and her team thanked Alliant ASO for not only providing valuable feedback on ABA services, but for assisting them to build a positive relationship with a valued provider. The health plan demonstrated a commitment to understanding this important service, and both the health plan and the provider are committed to ongoing communication and education because, well, they share the same goal: quality services and quality outcomes for healthier members.